Just as a Canadian who's always had healthcare, I just don't get it. I mean, every westernized country in the world has it, and the US doesn't. It's always just seemed remarkable to me. I mean, how can you not have it? Like, your health is everything.
Healthcare in Canada is something of a birthright.
I don't have anything bad to say about our health system. It's done right by me.
It allows Canadians to sit at home and know that they're not going to get wiped out by medical bills.
Anyone can access healthcare, anybody at all, no matter how severely sick they are or they're mildly sick. It's just paid for in our taxes. It's not like you see a statement, you never see how much it costs, but it's always there and it's taken care of.
You book the appointment, you go, and the card, you just give them your number and good to go.
If you're in trouble, you can get health care and not end up with a bill that's going to kill you.
Not anything that we even talk much about anymore. It's something you take for granted.
We rely on it, we just don't think about it.
And it's only when we hear our neighbors talk about it, when we talk to our friends in the United States, that we understand what a gift it is.
Oh, yes, I'm a real Canadian.
I am a real Canadian.
I'm 100% Canadian.
Oh yes, born and bred.
Yes, I'm a real Canadian.
I'm a Canadian.
A Canadian.
Canadian.
Real Canadian from Toronto.
That's just laughable.
I just laugh.
I find it inaccurate, exaggerated.
We get a little exercised when we watch the partisans take over the discussion about healthcare and drag our system in as some kind of boogeyman.
How could you possibly trash being taken care of? Your whole family, 100% all the time.
Because they don't know.
I think it's crazy to trash the Canadian system. It's a great system. It offers us alternatives. I think for the average person, it's a level of comfort.
When Americans trash our healthcare system, it hurts a bit because I don't think they're getting the full picture or understand the system at all.
It would be helpful to the discussion if they knew what they were talking about, if they'd had real experience here.
I think if I lived in the United States, I would probably not, like, knowing that I had to cover, I have 3 children, I have a husband, and knowing that the 5 of us had to be covered, I think I would be a little bit nervous of the fact that if one of us were to lose our job or something like that, that there may not be coverage.
I found out I have a hyperactive thyroid, so I was losing weight and I wasn't sure what it was.
The last 9 years I've had knee replacement.
Yeah, well, 2 years ago I had breast cancer. So.
I'm hearing impaired.
A few problems with circulation.
Colon cancer.
And pulmonary embolism.
Cysts removed and
Open heart surgery.
And so I called my doctor and went to see her, and then she sort of made an assessment, sent me for blood work.
And I just called my local hearing center and the government pays for it.
I wasn't happy with what they had to say, and I went to London, Ontario.
And they phoned Wednesday for me to be in Toronto on Friday at noon to see the surgeon.
I had surgery, I had chemotherapy, I had radiation, and I did not pay a cent for any of that. There's no money, no credit card, nothing exchanged.
The medical bill is picked up.
It's paid for.
You don't pay anything, you show your card.
In a normal situation, you would pay nothing for a doctor's visit. You were referred to a specialist, that would cost you nothing. If you went to a hospital for a procedure, that would cost you nothing, although increasingly sometimes there are additional costs for things like, meals, or your wife was probably going to have to pay to park.
I got $600 to help reimburse me for traveling to see the second opinion.
And the government actually paid up to $500 per hearing aid.
What would it have cost me to pay out from, well, I couldn't have done it. I don't have that kind of money.
There's no, what are you talking about?
What does copay mean?
By copay? I'm not sure what you mean by copay.
I don't know what a copay is.
Copay, I thought, was a drink you used to get with an umbrella in it.
I've heard about it just from some cousins, in the States. No, we pay nothing.
You're free to use any doctor you want.
I have my own doctor.
Yes, you can choose your own doctor. I have a GP that I go to, and if I have something that I need a specialist for, there's a list of doctors in the area, and if I'm not happy with them, I can get a second opinion and go to a bigger city, Toronto.
I've never had it happen where I've asked for a particular doctor and not been able to get that doctor.
I selected my physician. My wife selected a different physician. Our relationship with them are purely our relationships with them, not prescribed by anybody else. No one tells us where to go or when or how.
Yeah, I have my own family doctor, and I had Dr. Wald for years in the cancer clinic, and he retired the end of April, and I saw the new doctor on the 2nd of May.
I get every test that I ask for, so when I go every year, I get a variety of blood tests that I can then go to a clinic for. I get a test for bone density. I get any test I want. I get tested for colon cancer if I think I need to have that now.
Not an indecent length of time.
And if you're concerned about something, I've always got in usually same day, sometime next day.
Sometimes it can take a few days, a couple of days.
Generally, you can get in to see your primary care physician quite quickly. But if he's out of town, if he's not available, if he's booked solid and can't see you, you would then go to the emergency department, see another doctor, and that doctor would treat you.
There can be some waits, but I don't think they're excessive. We hear about these stories of long waits, but I don't know anyone who has had a serious medical problem because they've had to wait too long.
If you're sick that morning, you can usually get in that day or in the next day or two. Absolutely.
If you have elective type things, you're going to have to wait a while.
Delay is more a case of priority. It's a triage thing. If someone comes into the queue ahead of you with a far more urgent need, they'll be taken first.
If I'm at all concerned, I can get help. I can get back in the system really quickly.
Got in right away too. I had the surgery within a month after they found it.
If there's an emergency, you are at the head of the line.
And if I had to have an operation that couldn't be done in Canada and had to go to the States for it, they'd pay for part of it. Most of it.
I've heard of cases where the system may be busy in Canada and they would refer you for that treatment in the United States.
There are some cases where the government system in Canada will pay for a Canadian to go, say, to the United States and have something done.
We all say, because my husband has a lot of American cousins, we're always like, we're so glad we're Canadian.
Why shouldn't we look after one another? Who likes to see children suffer?
Canadians would tell you they get very good health care. When you look at the track record of the system, when you look at the efficiency of the system and how many people it processes and the outcomes,
you have enough worries when your child gets sick, but imagine that financial burden. We don't have that. We haven't even heard of that.
something like 92% of Canadians are happy with their health care.
It's like you're living in a third world country. You have nowhere to go. Where's the safety net? We just go and you're taken care of and everybody is treated the same, and that's what a democratic society is, isn't it?